What were the reservations, do you think, that other staff members had in your trust?
I'm certain most of us are not happy with it, but I definitely know everyone shares the same view. We're all happy nurses are finally striking because we do deserve a pay rise. And I feel like people don't understand it's not just about the money aspect, but like, other colleagues have said, it's about patient safety and about the fact we're responsible for a lot of people out there, a lot of lives, and people don't understand it's a very stressful environment to be in. So as much as we didn't get to strike today, we're all happy that everyone out there is going and is striking to get a fair pay.
Yeah, and in terms of the pay deals, I mean, obviously people are struggling, as they say, but it's the fact that there are 47,000 vacancies across nursing departments, and I guess a better pay deal would attract those workers in.
Absolutely. It will certainly attract more people in. I feel like a lot of people don't understand that the fact we're having to work in such critical environment is taking away the joy of nursing. It's taking away the joy of actually being around, everyone, caring for our patient and having more, pay and an adequate pay, because I feel like everyone in the country is going through a lot financially.
Yeah.
And having better pay means that although we know we're risking a lot by working in such critical condition, at least we can't complain. We have every reason to complain right now. We're working in a place that is really understaffed. We have a number of patients that, to be honest, the ratio between nurses and patients is absolutely not safe nowadays. And most especially, we're getting less pay for other people out there in the country that are not responsible for people's lives and are still getting better pay than us. So I don't really understand. We have so many vacancies because newly qualified nurses don't want to stay. It's a very critical environment. We're stressed, emotionally drained. So having a better pay would definitely go a long way in helping problem, in solving, or at least it will be a stepping stone to a better NHS.
Can I ask you, Olivia, have you considered yourself, your position in the profession and thought about giving it in?
Oh, absolutely. I remember, and I always share this view, I remember when I was training to become a nurse, it was during the COVID period, it was the most stressful period of my life. And being in the hospital setting, and I was in an intensive care setting, it absolutely traumatized me. And I really thought, oh my God, this is what I've always wanted. But everyone is complaining around me. No one is getting fair pay. The staff to patient ratio is absolutely applauding. Why should I even be a nurse at this point? And it really, really put me in a critical position where I felt like I had to leave. I couldn't stay in the hospital. I couldn't stay in an A&E setting, for example, or like an intensive care children setting, although it was something I would have really loved to experience. So I don't blame other newly qualified nurses or other nurses that are training to not actually want to come into the hospital, into the NHS. And this just goes on and on in like a very harmful circle in which the NHS has found itself, between people that want to leave and people that don't want to join. And unfortunately, like we said, the pay doesn't really help. Nowadays, the whole country is in a critical crisis financially, and really we're barely meeting like at the end of the month. We're struggling to pay our bills, our rent. But, if that was improved, it could really, really help. It could really, really go a long way. And I don't blame, the other nurses for giving up, because really it does take a toll on you.